Good afternoon. This is the House Appropriations Committee. It is Wednesday, January 21st, 2026. It's just after 1:15, 1:20, and we are continuing our budget adjustment work. And we have the DCF, the Department for Children and Families, coming in to talk to us. We learned some things from House Human Services last week when they came to present their budget information. And so we're really appreciated that you were able to come in so quickly and chat with us about some of the things that we have questions about. So, why not all of you introduce yourselves and then we'll start. I think we have some people who've got some questions to start us off. So.
Good afternoon. I'm Lily Sojourner, the Director of the Office of Economic Opportunity, which is in the Department for Children and Families.
Good afternoon, Miranda Graham, the Deputy Commissioner for the Economic Services Division. Megan Smeaton, I'm the DCF CFO.
And I'm Sandy Hoffman, the interim commissioner. We saw the memo that Rep Wood read from, and we have answers to the questions. If you want to start with that, I can just go through that.
Probably some questions in between. I know, I think Rep Jacoboni and Luli are kind of have your areas, so they're going to be the most expert. And I see that we have Representative McGill from House Human Services here too. So great. All right.
So the first,
by the way, before you get started, did you send that to Autumn? So do we have it?
no,
Okay.
we can.
Yeah, that would be great.
Okay. And then do you want to circulate the tables? I'll refer to these.
Okay, and then make sure that we get electronically everything.
Yep. So the second point that was in the memo, well, thank you for having us here and allowing us to clear up some confusion. And we hope that what we testify to today will allay some of the concerns that were raised. So the first part about general assistance, do you have the memos in front of you? Should I just?
We should have the letter that Teresa said gave us. So that's what you're referring to.
Yes.
Say item 2, general assistance.
Yes.
It's on page 3 of her. Okay, yes.
Okay, so as you know, Vermont is a shelter-first state, as stated in legislative language in Act 27. General assistance emergency housing shall be provided in a community-based shelter whenever possible. DCF acknowledges a sizable projected underspend through the first half of state fiscal year 26. Over the summer alone, we realized savings of $2.4 million as we had budgeted at a much higher room utilization than materialized. When building budgets, we utilize the best information available to us at the time, which is often 18 to 20 months in advance of actual operation of the program. And given that this program has not operated under the same rules for 2 years in a row since prior to the pandemic, we had limited data off of which to base projections. We saw lower demand than we anticipated over the summer months. And we feel it's important to make it very clear that DCF did not restrict days beyond what was outlined in the budget that the legislature passed. In order to provide a safer environment for children, DCF implemented family-only hotels. This was only done in districts where there were enough hotels or motels to still allow other access. We know that there is a lot of illegal activity taking place at the hotels because unfortunately we have put large groups of vulnerable people in a space where they can be easily preyed upon given the lack of appropriate staff. This summer, a child was lured into a room by another hotel guest, and thankfully there was quick action taken by hotel management. However, that type of risk is not an acceptable one, and DCF had to take action to address this, which led to some of the rooms remaining vacant. As stated in our response to Representative Wood, we estimate that it will be at least $5.5 million. This is perhaps better described as a range, though as we continue to see fluctuations room availability and utilization. The spring months are particularly difficult to project given the end of adverse weather and the renewal of the legislatively mandated 1,100 room cap. If we remain at that cap during the spring months, we may see even lower savings. In addition to the underutilization savings, the cost from our call center contract have been lower than we originally budgeted, and we are realizing some savings from vacant positions. All in all, we think a range of 5.5 to 6.8 million is reasonable to assume. And that's the table that we sent around.
So question on that. Yeah, so I'm seeing the table and we have the rooms budgeted. I guess, so July, August, September were quite a bit lower. But we still aren't up to we're 200 rooms lower than what we projected in January, February, and March. There's still 200 rooms that aren't being used. Am I reading that right? Is that good? I'm trying to figure out how we get to the 5.5.
We budgeted in advance of the actual capacity of rooms, right? We build our budget 18, 20 months in
Right,
advance.
so you projected you'd have 1,400. Does that mean we don't actually have 14 and 21 rooms available, even if we wanted them?
So I don't think, we have just about 1,300 rooms now open and no, I don't think that we have the 1,400 available.
So we budgeted for 1,400, but there's 1,300 available.
That are currently being used. I mean, if give or take, there are some rooms, because of the self-pay component, right? We have rooms that aren't available to us because people are in them and they're paying for them themselves. And we have an ebb and flow that happens every start of the month, with that. And so that becomes complicated.
Are people being turned away?
Every year, people are turned away and this is no exception.
Just processing all this, that's,
Yeah.
okay. All right, any other questions before we go on to the next thing? If you,
Well, I don't know how, if we're gonna proceed, I don't believe we resolved this issue, but, I'm not sure that I have, I guess I have a, kind of stepping way back. I have a broader question, which is when the department anticipates a sizable surplus in an area. And I would say that there's a sizable surplus in reach up, there's a sizable surplus in this, and may even grow beyond the 5.5 million to 8 million. And we have as many people who are unhoused as there are. What is the department's thinking about those surpluses? Is this just money you're gonna plan to roll into next year, or is this?
Yeah.
Or do you,
Yeah,
are you looking for ways to deploy it to meet the need that exists?
so this particular underspend is in the state fiscal year 27 budget to offset the housing initiative cost. So it's an $11 million projection for that. And we only asked for 6 million.
so you're gonna use carry forwards of this for which housing initiative? We haven't gotten to all the details yet, but.
No, we haven't.
This is for 27.
Yes.
Well, okay, I guess I'm confused because I voted for a budget that anticipated serving a certain number of people, meeting a certain number of needs that were spelled out that we agreed to. And now what you're saying is that this money is actually going to be used to supplement what wasn't available for next year's budget, right?
No, I think what I'm saying is when we set the budget, we used our best projections to anticipate what we would have available to us, what we could purchase in effect to serve the Vermonters that need hotels and motels. That didn't come to fruition in the summer. It was less than we thought we would need. And now we don't have all the rooms available to us.
But in the summer, wasn't the decrease in part because of the time limit that then immediately curtailed people's access to housing as of, I mean, I'm totally blanking on the number of days, but you know, and we tried to extend that from April through the end of the fiscal year, but I mean, this is more of a, I understand budgeting, you know, things don't turn out the way that you imagine. But in my community, in Burlington, it is a crisis. And I would think that we would want to do what we could do to find more hotel rooms, to identify, it's just a lot of money that we anticipated spending, and it is not that demand has actually declined. So my hope had been that the department would be aggressively trying to find alternatives, given the fact there is money to help meet the existing demand in Rutland, in my city, and in, the Barry Montpelier area.
And Brattleboro. And I can tell you that
Across the state,
yeah, we have been working hard with our partners in those communities to address the concerns that they have that do limit some of the hotels that we can use. And then the hotels and motels are private businesses, so they can choose whether or not to engage with us. We work with them to try to bring them on board, help them get the space they need so it's a safer place for the Vermonters that need to be in the hotels and motels. But we can't make that.
Oh, I understand. I just wonder whether the Human Services Committee could have been notified earlier about how much the spend, how underspent things were, so that they could work with you to figure out, well, how do we encourage motels or develop more community-based shelter capacity. I think that my understanding is that the committee had to ask, whoa, what's, how much have you spent down from what was appropriated for the GA program? And that was when they got that information, which is halfway through the year, so.
Yeah.
I don't think your job is easy in this. I can't imagine managing it all. But I also know it is 7 degrees out there, and we have a policy that says at -10, that's when community emergency shelter is available to folks.
0, right? 0. That's 0.
We were told it was originally minus
20,
and then it moved
it's-
to -10.
Whatever the case, actually, zeros, pretty cold. I'm sorry, I don't mean to get on a soapbox, but I just feel that we could be working together to more closely to share information about how things are going. I know you produce reports, but this piece of information was not available. And it wasn't shared with the other information, and knowing what we know about the number of people who are unhoused, I don't know how to square this. So I will now play.
Next question.
Yeah, I'm confused. This part of your graph is 2026. Is that correct? From June until July 1 until.
It's state fiscal year 26, correct?
Okay. And according to the paper we got, there's a 5.5 million underspend in general assistance as of January.
It's a projected.
It's
5.5.
projected, but it's underspent.
Yeah, that was.
So it's there available for the rest of the year,
So,
fiscal year, this year, 26.
yeah, so we have projected that for the hotel motel portion of the GA budget, based on what we've seen happen through December and where we project we will be for the remainder of the year, and you can see in that last column is the projected authorized, the things that are shaded are projections. We would be at 5.5 million of surplus.
So that's where that comes from. Okay. So now you're talking about, let's keep this, we're talking about the BAA. And then you made some comment, maybe I heard it wrong, but it said there was going to be, the 27 budget was going to include $11 million. But you only need 6 million, is what I heard. I don't know if that's right.
Right.
Is that because you expect to anticipate that 5.5 million that you can roll up to 27?
Right.
But we were for a different program, not for GA housing.
We're looking at it as when you're saying GA housing, you mean hotel motel. There's a whole housing initiative that we look forward to presenting to you.
Okay.
So we're looking at the whole picture and taking a holistic approach to it. So it's not just a certain
Yeah.
amount.
Yeah, okay. So we'll hear about that when
Yeah.
you come, but I think one of the concerns that I think some of us are feeling is we have so many people that are homeless, and we gave you a budget, and it's not all being used for the purpose for which it was intended. And that's hard, and I get, you're doing what you're doing in the constraints and the hotel rooms and all that, but it just is really hard to feel good about the fact that we have all these people who don't have a place to stay, and yet we have all this extra money and we're not using it to help those people.
Do you want to talk about some shelter stuff that was going on to help?
Sure, I can talk a little bit about the extreme cold weather shelter program and try to provide some updates. And I will say that, we've been pleased over the past several years that we have seen growth of year-round shelters, which just provides a lot of stability to those who are housed and the organizations that are operating them. And so that continues to be a primary investment for us. And one of the reasons why is because running a weather-dependent extreme cold weather shelter is just one tool in the toolbox, but it is complicated. And what we have found this year, and so to provide some context, historically, the operational period was triggered by a -20 degrees, and this predates COVID. So it's, again, a historical evolution that goes back quite a while. Last year, the agency adjusted that to operate at -10, and we had 2 sites regionally that were able to be activated. Last year with one-time funding, we were able to stand up a new version of this program, Extreme Cold Weather Shelter Program. We put out a notice of funding. We're working with Vermont Interfaith Action as our administrator. It is challenging to budget for a weather-dependent program, and we've done a lot of analysis with our colleagues around the state and looked at weather over the past few years. But we want to make sure that we're budgeting responsibly so that we're not in a place, February, for instance, where we don't have money to even operate at a -10. So we put forward initial projections at -10. We worked with Vermont Interfaith Action to have a funding opportunity for communities. Once we received those responses, we have made awards in 6 communities. So we have coverage this year in Burlington, Rutland, Bennington, Brattleboro, Montpelier, and Newport for the Northeast Kingdom. We did budget analysis and realized, okay, we have money to operate at a different threshold. So the policy allows for shelters to opt in at 0. It's mandatory at -10. They have to operate, that is the program. But if they have capacity, they can operate at 0. And what we have found is that funding is not the barrier for some of these programs. Some of them have staff constraints or constraints with volunteers, and some of them have space constraints where they cannot operate their space more frequently. So for that program throughout the winter, we're able to operate that program. Again, we've been able to operate it at 0, and it's not the money that is then prohibiting that from operating more frequently. We have a very close relationship with Vermont Interfaith Action, and it's been a wonderful partnership. Every month, we evaluate the budget and make sure that we have enough funding to continue operating at the optional 0. We are also talking with them to see, is there opportunity for expansion? Because we have some communities that have not been operating at 0. We have funding available. They're doing some assessment with their contacts to say, oh, are there other regions that may be interested, or is there TNTA that they can provide to other communities to help support them? There are a few communities that just have organic programs that don't necessarily want to have the strings attached of a state program, but maybe they could use some training and technical assistance from Vermont Interfaith Action. So we're continuing to really make sure that's supportive and accessible. And for that program in particular, funding is not what's preventing that from opening more. And then additionally, throughout the year, we have been able to support the requests that we've received for shelter expansion. So just for instance, in Montpelier last week, they opened a new seasonal shelter that we were able to support. And if it's helpful, I can talk through other projects that we have coming online. So we continue to just make those investments. And then again, as the commissioner said, that continues to be a theme as we head into next year of like, how can we make those commitments and grow shelter capacity around the state and address gaps that currently still exist.
And I would follow that up. Yeah, so there's $2 million in OEO request for shelter capacity and is this $2 million to support that work that you're talking about?
Yeah, it's the intent of the department to increase shelter beds and to strengthen the existing shelter bed system, including expanding seasonal shelters where possible. Shelter expansion work is often sensitive in communities and involves zoning and other reviews, and often involves a competitive procurement process. And sometimes the projects come to fruition and sometimes they don't. We have potential projects that would increase capacity, and we can't currently share all the details about it, but as soon as we can, we will.
Is it likely that they would become operational in this fiscal year?
Yes, FY 26.
So that's why it's in the BAA.
Yes. So that. Yeah, so we sort of jumped down to number 5.
I did,
Yeah.
yes.
It is related, talking about that.
Because it's an OEO request and I.
And these are year-round shelters or seasonal, this 2 million that you want?
Year round, we're hoping that they'll create year round capacity. In particular, those, yeah.
And where are you getting the $2 million from to do that?
The BAA.
Yes,
So.
right. So, but what we heard was, maybe they're two separate things. So if we move on to community partners, the also OEO on the back page, the 1,322,000. It sounded like the state reduced top money here and is maybe using that money for the shelters over on the other page?
No, those are
They totally
they're
separate.
separate issues. Yeah, that was one-time money that was used and it, I guess, has become an expectation, but it was one-time money that was used for the providers.
For HOP, for the.
For financial assistance, yeah, the primary driver is the winding down of significant one-time federal and state funding, which was an insurgence of money issued to the providers. Over the past few years, really starting in state fiscal year 21, we had significant influx, specifically the coronavirus relief funds were used for 2 years to create flexible financial assistance for individuals. Then starting in state fiscal year 23, we've had some significant one-time investments of state general funds, which have supported client financial assistance. And those are just winding down. And so, for instance, at times we've had almost 4 million of this one-time funding.
Right.
And at this state, we have about 500,000 left that we're using this year. So that is really the primary driver. For this.
1,322,000 was not in the budget that we passed last year.
It was a one-time appropriation.
So but we made a one-time appropriation of this amount,
So,
or that was included in a larger amount. This is.
yeah,
So we appropriated this money to be used for HOP.
not always over the past 5 years. So over the past several years, there have been a number of one-time $5 or $10 million that have been issued in conjunction with sometimes these changes in the general assistance emergency housing program. They've often been not direct HOP appropriations that have had much larger budget language around, helping with community-based services or help, so the language has been quite large, and we've used subsets of that money to help support financial assistance during this time. Again, if you go back to pre-COVID, we supported this activity through HOP at about $1.3 million. And currently this year, it's about 2.4 million.
We've
with
had a lot of inflation
combination-
and raising costs, yes. So
Right, so it's a combination of about 1.8 in base and then 500,000 in one time. So we appreciate that it's an important resource, and unfortunately, like other things over the past several years, when we've seen the reduction in federal funds, and then sometimes these one-time state general funds, that's a challenging dynamic as we continue to then prioritize investments. So it's
So what I'm trying to get at, I'm not very good at asking these questions. Let me try to be clearer on this. Did we appropriate this money for a specific purpose in the budget? Did the General Assembly appropriate this for, and then is it being reduced and being used for some other purpose than we originally appropriated the money for?
This isn't up in our budget. It's not a one-for-one down with anything else. So I would say no to that. The funding that you're talking about is in a different appropriation, and we are not reducing that. It's a one-time appropriation. We've been spending it down. And that's, once one-time appropriations are spent.
Yeah.
And so in so much as anytime you do an up in a BAA, there's oftentimes, we're working with a set budget for the year. I would say that this is not connected with that, with the financial assistance one-time allocation at all. It's an up that we're asking for investments in shelter capacity.
So you're asking for an increase in shelter capacity. Yep, that's on page 3. So back up page 4, this reduction totaling 1,322,000. What is being reduced?
They're just not getting the money again because the one-time funding has ended.
So it wasn't, so we never appropriated it in the budget in the first place?
For this year. So we rolled money that was appropriated as one-time funding last year into this year. We still have $500,000 left, like Lily said.
Okay.
But the money was not appropriated for this year.
Okay.
And so we are utilizing what's left, and then the one-time money is gone.
I guess, I'd like to ask what's lost by by not using this money for community-based providers, what services are lost? I will just.
I'm sorry.
How is it? Come on, that's fine.
Yeah.
My apologies for jumping in. So specifically, it is what we refer to as an eligible activity under the Housing and Opportunity Grant Program for direct financial assistance to households. So it's money for things like security deposit, help with utility assistance. So it's that portion. It's not staff services. It's that direct. And that, again, pre-COVID, we were about 1.3 million with the infusion of one-time funds. Sometimes we've been able to award as much as 5 million. And this year we're back to 2.4. So again, it's just the end of the one funds.
Does this money often help people stay in housing?
It often is used, I would say most frequently at sort of 2 moments in time. I think when people first exit homelessness and get into housing, again, so security deposit, addressing that surge in costs when you leave, for instance, a shelter or GA and get into housing. That's a significant driver. Another significant driver is that it has a limited amount of ability to help with rental arrears. So it can help if people have, for instance, they get sick, they fall behind in rent for a month, they need a little bit of help to maintain their apartment. That's another eligible request. So it's used in both of those capacities.
Yeah, I'm, yeah, I'm taking it in, thank you.
Okay. Dave,
Back to the 5.5 to 6.5 million savings in GA. Notwithstanding the proposal that will be coming to do more shelters or other initiatives. We could in BAA, could we not? I'm using this for illustrative purposes to make my point. We could say, there's unused funds, this amount. We think it's good policy to extend the winter program from March 31st to April 30th. And we believe that will cost, the department would tell us, that would cost X amount. Surely not the whole 5.5 million, I don't think, based on the way it's going. Or we could do something, say, instead of 0 degrees or -10, we could up that temperature too. That's within our BA in FY 26 with funds expended to GA. Madam Chair, is that type of thing within our authority?
it might be. It might be. I'm not sure I have a definitive answer for you on that one. I see where you're, I'm not sure I have a definitive answer.
Oh, okay. I thought.
You see, I did hear Lily say that the temperature didn't seem to be the issue with the emergency shelter. It was the constraints around not having the people to be able to open the shelters at certain temperatures. So that may or may not, I don't know, maybe that's some places and not in others that would require a little bit more information, but I hear what you're saying.
There is a part of me that says in the moment
Yeah,
of now,
right,
the Vermonters in harm's way.
right.
There's some good programs that might happen in the future, but it's a big policy question. Do you say, I'm sorry to those who are knocking on your door because we've got other plans? And that's within government's prerogative.
Yeah,
But I'm just trying to understand it fully
yeah. It's
before I decide.
it's
Thank you.
thorny. Wayne, oh, Nolan and then,
Question, I'll have to represent, for the record, all knowledge of this office. In your fiscal year 27 budget, have you assumed savings from 26 out of fund 27? And how much?
We are projecting to be able to roll out the housing initiative that we proposed, that we would need $11 million of funding for shelter capacity building. And we reduced that to 6 million in the ask, accounting for the 5 million that we have.
Do you assume it's 5.5 million? Very full. Okay, that is, and so that's to that point, any of the money that you decide to spend or use within BAA on the 27, that's good.
right. Yeah. Thank you. Wayne,
Let's just start out with, I have concerns, of course, always. We start out with actual number of people housed per night. Like, do you have numbers of people that were housed in the GA program in the hotels for every night so that you have a tally of the total number used? Do you also have a tally of the total number of people used on a per night cumulative basis for your shelters? And so the question would be is there any change in that distribution? Are more people going to the shelters than the GA housing? Have you had a shift? And is it more expensive in the GA housing versus putting somebody in the shelter? Does that impact any of this conversation on the not of money being spent? Do you know those numbers?
So I can speak to GA. We do know how many people we house every single night, and then also how many people are also staying in the hotel because they have to pay for their own stay for a certain number of nights when you have income. So I can tell you as of Monday this week, we had 1,257 households that we were paying for, and then there's an additional amount of folks who were doing their self-pay, so we're just under that 1,300. It is $80 per night in a hotel room. The cost that isn't factored in is the cost of the municipal services for the community where those hotels are, and those can be quite significant. And we are hoping that we will have some communities come forward with those costs, because their ambulance, their fire, and their police services are often going to these hotels because of the needs of folks.
So I've always had concerns about Vermonters and what are eligible Vermonters there. And I know there are some ways to game that system. So given the fact that federal money is involved, when was the last time was this program ever audited?
So this is a general fund funded program, the emergency housing program.
Is all of it general, in the emergency shelter parts? Because
The shelter part is separate. So the hotel motel program is 100% general funds. Lily can speak to each of shelter capacity.
We do have some federal funding that we incorporate into the housing opportunity grant program budget is primarily general fund, but we do receive funding through HUD through the Emergency Solutions Grant, and that does support some shelter operation within the state.
I've been asking this kind of questions, from various people coming in, because I'm concerned that if, something happens at the federal level, that it could burden us in some way that we don't anticipate. Okay, thanks.
Okay, let's continue.
I think that covers the first one. So question now, we're going to reach up.
Okay.
And we appreciate the recommendation to accept the reach up adjustment, but want to address the misconception that's a perennial negative adjustment. In state fiscal year 24, we had a pressure of 8.4 million up in our budget for reach up caseload. And in state fiscal year 21, we added 5.1 million. And those fluctuations in projected caseload represent complexities of macroeconomic conditions and can change quickly with little notice. Changing rates would result in even larger budget pressures when cases inevitably trend upwards once more.
Any comments on the reach up one?
Well, I'm just wondering, so what will that $2.32 million be used for?
So I can't say like on a one-for-one basis, it's not like we're taking it down and putting it somewhere else. We are saying that our kids is below that amount, below what was budgeted. And so that money is reverting to the general fund. There are pressures everywhere, so I can't say like one for one what it would be spent on.
Yeah, so any reversions to the general fund are not specified, which is how you have to do it. We did learn that about reversions. If you want to repurpose it, it has to be reverted to the general fund and then reallocated somewhere else. So it's a two-step process as opposed to using carry forward. But no, there seems to be no appetite for having carry forward within that program, even though you think inevitably it's going to go up again.
Our current projections show trending downwards through 27. And we use a consultant who does those sort of macroeconomic projections for us.
Yeah. Is this the one where we're assuming housing costs from 2001?
In the
Readable.
rateable reduction.
How come we're doing that? Help educate me on why we would do something that's 25 years old.
So we did produce a report 2 years ago that looked into what it would cost to change the rateable and to be able to increase people's benefits. I think at that time it was to increase it from the current of 4.96 to 0.6. We needed $5.5 million to be able to make that increase. What we don't know is how many more households would then become eligible for this benefit because you'd be increasing that threshold. And so that's a little bit of an unknown for us and could also increase what we would need. So I think it has been investigated, and I'm happy to produce the report because it's probably buried in lots of reports. You have it.
How many households who are on Reach Up are also in the hotel motel program?
We do have that. I don't have the number off the top of my head, and unfortunately, the phone a friend that I normally would have could get it to me in moment's notice is on vacation, but I can get that for you. But we do have crossover, there, and I can give you the.
I'd be interested to know if it's 3 or 300 or somewhere in between. That would be great to know what we're talking, because that feels like we're defeating ourselves if that's happening. And I know a lot of this is coming down to money for you, but if we're using 2021, I don't think any of us could live on what people are getting when housing prices are, so vastly different. And then that throws them into another program where they need services that it can be a self-defeating sort of cycle, which is very frustrating. Yeah, Dave.
If we could also find out how many of the recipients or households are receiving what we call Section 8 vouchers?
On Reach Up.
Thank you.
Of course.
Okay, on Reach Up.
Keep going.
Okay, the OEO positions. Those positions are active now and are critical to ensuring program safety and integrity, as well as maintaining compliance with federal requirements to ensure access to federal funds. So that speaks to the potential audit that was just mentioned. So,
This is number 4.
yes.
Let me just read what she said here.
So this also came from Hop.
Yes.
Yeah.
So 2 limited service positions so why are we changing it from grants to personal services? Say that again, I'm sorry.
So
As you're creating 2 new positions?
as the program has grown dramatically, we've needed additional roles to help ensure program safety and integrity, as well as maintain compliance with our federal requirements. So these positions develop and maintain training, technical assistance, policies and procedures. They support statewide data collection and reporting systems. For instance, that reporting helps ensure that the grant awards are actually fully spent and utilized. Through our quarterly reports, we can identify issues such as vacancy issues, issues with emergency apartments being online, that help us then follow the programs and ensure that they are on track to spend their awarded dollars. So it in some ways helps make sure we stay on track with spending down the awards as in their agreements. And then really critically, they conduct monitoring. So this is crucial programmatic monitoring. So review of case files, policies to ensure that our standards are being followed in these programs. And then also annual habitability inspections, which is on the ground monitoring of shelter projects. We've not only has capacity grown, but the number of separate shelter projects has grown. So for instance, we had 28 separate programs in state fiscal year 23. Right now we have 41. We are also regularly called upon to help do site reviews as shelters develop new projects. So we're often going around looking at physical sites with shelter providers to say, yes, we think this is has the potential for renovation, or here's some things you might want to talk to your architect about. And so, we were doing annually about 23 inspections a year pre-COVID, and last year we did 47. So all of this is really creating pressure and the need for these positions to ensure that shelter guests and other recipients of this funding to help support them are really getting quality and safe services that can meet their needs.
So what would happen? Why does this have to be a budget adjustment? what would happen if we waited till the FY 27 budget to do this?
So these are existing limited service positions that were authorized to support emergency housing. And given that the emergency housing language specifies we're a shelter first state, and it's still supporting housing, they're now been moved to OEO. But the budget to support those positions does not exist in OEO. So
Where does the budget to support them exist now?
they were funded with one-time funds prior situations, in a one-time appropriation. And so
So you're moving it to base.
we
Your
are,
proposal is to move it to base.
this is BAA, so this is one time, but I think you could say that it's an ongoing need.
So what happens if we didn't do it in the budget adjustment and waited to the FY 27 budget?
OEO would have a budget pressure for these positions. They're filled positions.
They've already been moved and this is sort of a retroactive asking for the money? Is that, I'm just trying to understand this, sorry.
Yes, we're adjusting the positions in the budget as
And there's money coming out of where to fund OEO? What's being reduced?
so overall, we are proposing an increase to the HOP budget in BAA, but a portion of that is going from the HOP allocation up to personal services within OEO to support OEO's ability to oversee that budget.
So the positions are using money that would otherwise be used for direct services to people?
I think yes, and you can't provide direct services if you don't have the supports around there to ensure that they're providing quality.
You can tell I'm not an expert on this. I'm just trying to find my way through. John and then Wayne.
Find my way through. So thanks for explaining all this. I know it's complex, and there's lots of moving parts here as well, but I'm trying to understand. This is a follow-up to Shai here. So the two limited positions have already been allocated in a place, correct?
Yes.
So those would move from where they are now, which is currently.
They're currently, they were in ESDs.
They're now moving to IE. So we don't need extra money for this thing, correct? If the funding already exists for those two positions in a place, we're just simply shifting where that's going to be in OEE. That makes sense? Question I'm asking, you're kind of asking.
I was asking sort of the same.
It's sort of the same thing, but I'm just asking a little different.
The money,
So if you have money in place for a couple of limited positions, then that those positions need to be shifted here with money that's already currently funded for those. We don't need extra money to be for those two positions. Do you understand my question?
I think I understand your
Because
question.
we've seen some come through BA where sometimes we're better off in a different location here, perhaps. Money's already been allocated for those two positions. So it's really just kind of a shift.
so I think they're asking for retroactive approval. So like they've moved the people
Already.
and now they already moved the people. Now they want the money to follow the people. Do I have that right? Is that-
It's just simply a shift to where that's going. So you need additional money for that.
We're whispering and we can't hear you.
I don't know that there was money, because I think what Megan's saying is that it was one-time money
Right.
that we didn't have. And so that's why we're making the change as a shift this fiscal year.
So is that
I
one-
don't know that there is much there.
There's not, so
was
the
that-
money
so
gets
was that
spent
one time?
down.
Sorry. Yes.
Oh,
Before
sorry.
you start,
Okay.
you might change your answer. Or need to, just to help explain. So the one-time money has already been appropriated for these two positions.
I don't know if I would say that it has been appropriated. These were previously funded with one-time money
From which year?
from 25, no.
In the 25 fiscal year, not the 26 fiscal.
So did we didn't fund the positions into FY 26
That's what I was
at all?
getting at.
Because we didn't need them any longer. So they were at economic services.
Correct. And so they were, so you eliminated two positions that were vacant.
Limited service.
And now you want two new positions.
Those positions to run that program, to make sure we're doing the stuff that we need to do in that program so it can continue. but it needs to be funded. We have the positions that we can use, but they just.
Were they from the pool or from,
They were from the economic services and it's all under the emergency housing.
so the positions were transferred from economic services to OEO,
Right.
but there wasn't any money for that.
That's kind of.
So now you're asking for money, but you're taking the money from somewhere else. Because this is net neutral, it says, right?
Right, we're utilizing the money. So as the Housing Opportunity Grant Program has grown, I think it was 7 or 8 million pre-COVID, and now it's over 30 million.
Yeah.
We have not, there has not been additional corresponding administrative and operational support, and so that's the investment here, and so while it is a shift away from the grant line item, for us, it really is important because again, if we can't go out there and say, yes, the shelter is safe.
Yeah.
They can't open. If we can't go out there and say, yes, you've sufficiently resolved this issue after you had a fire or flood, they can't reopen. So,
Resources to do the work.
right, and again, you know, when we do our quarterly monitoring, review of reports, we're getting information and able to follow up on, oh, there's an issue with, these emergency housing apartments. They haven't been able to come online for the past 2 weeks. That lets us then follow up and say, hey, what's your remediation plan? Because we've awarded you this money. We want to make sure you spend it down. It needs to get out the door to Vermonters. So I think, while it is a shift, I think again, in some ways it is needed to help them get the money out the door.
So then my question is, why wasn't this in the FY '26 budget at the beginning?
I think it was a timing issue just due to the process of how long.
Yes, I don't know if we knew, like I said earlier, to build this budget 18 to 20 months in advance.
Right.
So it's hard to know until you know what the GA program is that you're operating, what resources you need internally. So I think sort of a combination of the timing of, we have these resources available, OEO has a need. We can merge those two things, move the positions.
And they were hired when? May, October.
October and this month.
Wait,
So it sounds to me like these positions would help you deal with the concerns that I have about accountability and related things.
Yeah, and I think also provide better support to our recipients, right? That combination of support and accountability is more responsive, but then also address any issues that there are.
all right, I think we understand it better. Thank you.
Thank you.
Sorry for all our questions when we're, it's we're not the Human Services Committee. Okay, so, and then the next one is the shelter. Higher than anticipated costs.
We talked about that already.
Yeah, did we say where the money was coming from? It's just coming from like the revenue upgrade or, you know?
So the up in the 2 million?
Yeah.
So it's a BAA app. So I think going back to what we talked about
Okay.
before, that's.
Yeah. All right. Okay. Okay, so we're at secure residential?
The committee recommended accept that.
Right, but there were concerns about a full picture of the annualized funding needed has yet to be presented, so.
Can I ask a general question about that? I think I saw a spreadsheet last year that indicated that the ask for last year did not represent the total cost of this and was funded through past one-time money that had been carried forward. And I just am wondering what is the total cost of this line item?
Of which line item?
The secure residential treatment facilities?
So, we have shared numbers, I believe, we've shared numbers now, about our projected needs for, secure residential treatment facilities. We have a variety of funding sources available. We've got a one-time appropriation that we can draw down on. We have carry forward that we have brought from last year that didn't get spent. And we have the base budget and a BAA ask. So all of those combined to a total of 11.6 million for the state fiscal year that we project utilizing.
So the 1.9 is part of the 11.6? And the stopgap method to fund crisis stabilization services, is this because we don't have a Woodside replacement, or is this something else?
Yes, this was the budget that was intended to cover the costs of a permanent secure treatment facility within the state. We do have West River Haven operating, which is a 3-bed permanent facility that does short-term stabilization. And then we have Red Clover as well.
Right. The Red Clover was funded somewhere else, right?
It's through the one-time appropriations.
Yes. Yeah, and I may be mixing up my fiscal years now, it's just with Red Clover. So the 11.6.
That would then be an annual, I mean, we could expect. We haven't had the budget presentation, but then in the coming year. Would this 11.6 million, I mean, what is the cost of this line item? Do you have that on hand?
For 27?
Yeah.
Yes, I do have that. It's less next year. We hope. We are projecting 8.8 million next year.
And is that because we don't actually have a place?
We're in negotiations now.
Again,
Can't really.
Here comes the charm.
We've had West River Haven enables us to move away from some of these high-end crisis placement and stabilizations. So the goal is, to have a more cost-efficient approach moving forward.
I feel like we've had the 1.9. Wondering why we need that in the budget adjustment.
So we need it in the budget adjustment because without that, we would be 1.9 million short of the 11.6 that we project needing between our various funding streams.
And we didn't know that at budget time.
We did not know that. So the West River Haven facility, we had anticipated 2 beds and we were able to get 3 beds.
And that's the full reason for the 1.9? Or is that just part of it?
West River Haven's effect is about 4.3 million total.
Okay, thank you. All right. Okay, and so we did the OEO. I'm sure I could explain it in a lecture, but we did it. We talked recovery centers in the. What else are we missing? What other questions does the committee have, or what else would you like us to know? If there's anything else you'd like us to know.
I think that's it. Hopefully that clarified things.
I may need to follow up with you. Because there are a few things that I don't yet understand, and I'll be following up with human services as well.
Great, yeah, I swear. Dave, are you good on your questions at this point? You are? Okay.
Yes.
Anybody else?
Didn't come up, so,
Okay,
I mean, rates not in.
well, lots for us to ponder and chew on, as always, when we hear from you. Thank you so much for coming in. We do appreciate it. Thank you.
Thank you all for looking.
And if you want to submit it, you could submit your,
Sure.
Mark, that would be very helpful. Thank you. And
Thanks.
And then submit electronically this sheet too, so we can post that.
Okay.
Perfect. Thank you very much. All right, Eddie.
Back again.
Please don't be scared.
Yeah.
There.
Let's take a 10-minute break. Emily's here to go over stuff, but we need to have a 10-minute break and clear our heads and get on